For this talk, what I've been asked to do is two things, is to give you a little bit of a description of some of the current research that's going on in Canada in this particular area, and also to describe some of the current research funding opportunities. So I'll try to do those. I do want to give a caveat emptor, or a buyer beware, a warning, that this is a selective description of studies, and I apologize to the many people who are doing wonderful research that won't be described here, and I can't promise that I'm accurately going to describe the research opportunities. Most of them that I describe will be through CIHR. I'm not a representative of CIHR, so I would certainly encourage you to contact CIHR or to look for more information, but I'll do my best to describe some of this research and some of the opportunities. So the first study that I found, I did a literature search. I used electronic databases and keywords, and also did some hand searching and tried to select some of the studies that have been published over this past while that I think really show this important area through the eyes of Canadian researchers. And an important piece of work that was done, actually by a couple of the authors who are here, Alain and Helen and others, was a study that used the data collected by Statistics Canada in their 2002 national survey. This was a survey of 37,000 people in Canada, the first national study of mental health in the country. And the authors used the data to have a very careful descriptive look at what services were people really receiving in Canada? How did this look? One of the very important findings was that, well, most people, in fact, were getting their services in primary health care. Most people with mental health problems in Canada received their services there. So this has opened our eyes to understand that this is a very important sector within healthcare for us to understand. Another study that used the same data from Statistics Canada was done by this group, Goldner and some of her collaborators, and they also used this data from this national survey, and they looked at how adequate the services that people are receiving. For some of the conditions in this paper, it was about anxiety disorders. How adequate were the services based on the kinds of recommendations that we have in clinical guidelines? Were people getting good quality care? And they found was that, in fact, most people don't seem to be getting the kind of care that we would really like to be able to provide in terms of the number of services they're receiving, the frequency, the type of services, so that we have a lot of shortcomings in our ability to deliver the quality of care that we would really like to provide. So we have our work set out for us to actually try to transform services. And you'll know that there's a great deal of work that's being done across the country. Every province and territory in Canada is currently embarking on some work to improve the delivery of mental health care services within primary health care. Provinces and territories are doing that in very different ways. There are these natural experiments that are going on across the country, which is fascinating. But there's an effort going on. So I think people, certainly people working in government, have recognized, as people have at the front lines and people who are receiving treatment, that there is a real need to make some changes and to try some different approaches. This was work that was done, representative work that's being done using different methodology. This uses administrative databases. And as you know, administrative data are collected by governments across Canada, usually sort of automatically. Often, for example, physicians or hospitals would be required to submit data electronically, and that is collated by governments. through careful procedures that protect confidentiality, there is an opportunity to utilize that data. It's usually anonymized and aggregated often. But there's an opportunity to use these data, which is actually a fabulous strength in Canada, that we can do that we have a public healthcare system where we can actually obtain data on all of the people in a jurisdiction that have received services. So a number of researchers have utilized this capacity that we have, and I would say that this is a trend that's been growing over the past while. I've seen more and more researchers applying this effectively. I know Paul Kurdiak will be presenting a paper at this conference where he's utilized this approach to look at the delivery of mental health, primary health care kinds of services. And I think we'll see this growing. I don't think we've fully utilized this capacity by any stretch of the imagination, and we'll see more of this. And again, these studies, one that was done in British Columbia, one that was done in Alberta, also showed that primary health care is a very important place for delivery of mental health care services. A huge proportion of people are really only getting their services, as far as we can tell, in primary health care. So what happens in that short period of time where primary health care providers are spending time with people becomes essential. Interestingly, some research has now compared data that have been collected through surveys, like this national survey that Statistics Canada undertakes, and the administrative data. It's possible to link those data together at an individual level using personal health numbers or other types of means. And so you can actually compare the data that are collected through surveys where people are interviewed and give self-report, and through the administrative data that are collected. And what's been emerging over the past while are some interesting findings, which are that it seems that when people do self-reports in surveys, that they often can't recall many of the services that are provided. It seems that the surveys that are done are generally an underestimate of the services that have been received. And that, so these administrative databases again become very important for us to understand the services that people are truly getting and for us to refine those techniques. This was a study done by Joanne Palin, primarily as her doctoral thesis, where she was able to link the data from Statistics Canada to the administrative databases and look at the delivery of mental health services within primary health care. There have also been a number of studies that have used mixed methods approaches, that have used qualitative and quantitative methods, often through interviews, focus groups, collection of surveys, and have pulled that information together. This is a study done by a group here in Montreal, where they looked at 60 family physicians and collected information about some of the challenges that exist within the delivery of primary health care services to people with mental health. This is another study that also found some of the obstacles using mixed methods that exist within primary mental health care. And there have been a number of excellent studies that have looked at some of the initiatives that have been put forward to develop new models of delivery of care. This is from Nick Cates and the group that he works with, the Hamilton Family Health Team. And I would describe this as a case study using mixed methods, where they've really looked at their experience in delivering collaborative mental health care using a particular set of approaches, and have described in some depth some of the outcomes and experiences. There have been other studies that are similar. This was one that that was done in a small community in British Columbia that looked at some of the challenges in a semi-rural type of setting, delivering collaborative care, and came up with an interesting model of placing a navigator in place. This is a group in Ontario, and again in a rural area, that showed that they were able to make some substantial improvements in the delivery of mental health care using a collaborative approach. It was recently published, and they found that their shared care, collaborative care services reduced waiting times by 40 days. They could really improve the delivery of mental health care and access to services. This was a study that was done in Nova Scotia, where they looked at services particularly for people living in an inner city and marginalized populations, and again, they were able to demonstrate substantial improvements. And this is a study that showed that the addition of psychologists working in a particular way attached to working with family physicians were again able to show improved outcomes. And a study that was done, published in a report to the Canadian Health Services Research Foundation by Louise Fournier and her colleagues here in Montreal, collected data in a number of primary care settings throughout Quebec, and was able to show again some of the advantages at the delivery of collaborative care services. There's also a substantial amount of research that's in progress that is not yet in the literature, but there's a lot underway. Jamie Cahspr and her colleagues here in Montreal are currently doing a randomized controlled trial of a telephone-supported self-management intervention, and is also looking at the patient experiences of collaborative care. In fact, here in Quebec, there's a real hotbed of research in this area. There's a lot of very, very high-quality work being done. So in the sort of brief time that I have left, I'm just going to quickly describe some of the opportunities that exist for researchers in this area, because I think now is a wonderful time for research in this area. CIHR and other groups seem to have recognized this as an important area. I won't mention the opportunities that exist through some of the provincial research funding organizations here, but you certainly could look into those as well. Of course, there are the open operating grants that CIHR has, but there's also a large signature initiative that CIHR is currently offering called Community-Based Primary Healthcare Research Project. They will be funding teams, also be providing funds for health professional scientists, and they will be funding the SPORE networks, which I'll speak about briefly as well. The Partnership for Health Services Improvement projects through CIHR is another excellent opportunity. Usually requires matching funds from health care delivery organizations or governments to work in partnership. And the SPORE networks, which will be really substantive networks across Canada that will provide some of the infrastructure and support for people to do high-quality research, are being developed. And CIHR decided that the first two networks would be mental health and primary health care. So there is, again, a great opportunity. Each of the provinces will also be developing support units that will provide this infrastructure. So I think we'll see a great deal of activity over this next short while. For people who are doing training, there are the strategic training initiatives. There are some that focus specifically in primary health care, like this one. And there are, of course, training awards that are available for people, and for people who are early in their careers, there are new investigator and clinician scientist awards. There's also the North American Primary Care Research Group and Primary Healthcare Research and Innovation Network the CPHCRIN that has been developed, which will offer a great deal of support and services to researchers in primary health care. As Nick mentioned, the Mental Health Commission is supporting a significant project, and in this last slide you'll see my email address. If anyone would like a copy of the slides, I'd be pleased to provide them. There's also the email address to Lisa Peterman, who's the director of the Knowledge Exchange Center, who can provide information about the CHEER project. Thank you very much.